So most of your life has been effortless, not having to worry about hearing or missing words in conversation, but yet lately things have changed. You're starting to miss a little bit of the conversation, and maybe it's making you a little restless about things. So you're asking people to repeat, or maybe you're finding yourself in a noisy restaurant and you're struggling to hear the conversation. Well, you're not alone. Millions of Americans suffer from hearing loss. The hardest part is most of them don't know it. The best thing that you can do is go to a professional, whether it's an audiologist or a hearing instrument specialist licensed by the state, and go have your hearing tested. The procedure is painless. It doesn't take very long. The counseling session is usually about 45 minutes in the time that you'll spend. You should look for someone that is either board certified in hearing instrument sciences or someone that's a reputable audiologist. If you're not sure, ask your doctor, who is your general practitioner, and ask them to give you a good recommendation. With regards to hearing loss, I just want to let you know that it is usually gradual. So a lot of times it's very hard for folks to understand that they have hearing loss. They don't know that. So most often it will be a friend or a family member giving you some clues that you may be having some trouble. You might be missing parts in conversation or having difficulty in noisy restaurants, for example, or noisy environments. Or maybe you complain that people mumble or they don't speak clearly. You know, if they would just talk better and I would be able to hear them and understand them more. Or maybe you're straining to understand words. Or perhaps you ask to turn the television up louder or the radio so that you can hear it. These are all signs of hearing loss. And if you're finding that you have some of these things, then I would encourage you to go see a hearing instrument specialist, an audiologist, your ENT, ear, nose, and throat doctor, or your general practitioner to go see how we can remedy that. So let's talk a little bit about the causes of hearing loss. How does it happen? You know, hearing loss happens in different ways, and when you go see an audiologist or a hearing instrument dispenser, they'll do a battery of tests to find out exactly where in that auditory system where there is some trouble. You know, the delicate hair cells inside the inner ear, when they start to, if they atrophy or are torn out, let's say for example to exposure of loud noises, when that happens, that's what they would call a sensory neural type of hearing loss. If the bones in the middle ear are having difficulty, or maybe in the outer ear where there's some earwax, if you have an obstruction or difficulty in this area, then they classify that as a conductive hearing loss. Now some people have a little bit of both. They have trouble in the outer ear, maybe the middle ear, and they also have trouble with the neural response or the sensory portion. They call those kinds of hearing losses a mixed loss, that you may have both. In any event, in either way, it doesn't matter how old you are or your age, your race, your ethnicity, it doesn't matter. Hearing loss can affect everyone, and it can affect you for different reasons. Let's say, for example, you worked in a noisy environment and you were being macho and you didn't wear hearing protection. Well, later on now in life it has kind of crept up on you. Well, exposure to noise, heavy, loud noises, or not only just impacting noise, but situations where you're exposed consistently to that same level of noise over and over and over again can also attribute to hearing loss. Sometimes drugs that we take are ototoxic and they have some side effects which affect us. It's important to talk with your doctor and your pharmacist to make sure that the drugs that you're taking or the medication, especially if they mix them together in some reasons, don't have any other side effects. And your pharmacist is probably one of the better folks to talk to about that as they understand drug interaction. But some of the ototoxicity can also give you a sensory neural type of hearing loss. It can come on quickly. In other cases, hearing loss can come from a virus or an infection in that inner ear, and that can be a sudden onset as well. Sometimes there's birth defects that have this and that accompanies hearing loss, or maybe people are born, for example, without a pinna or without an auricle here, that they don't have a way to receive the signal to their ear. Or let's say, for example, you play sports or you're involved with grappling or martial arts or different types of things where you have had maybe a head trauma or a concussion, or you were involved in an accident. All of those types of things can affect your hearing, and that's why it's very important to go and have a hearing test done. If you're over 50, the American Medical Association recommends that you have a hearing test done every year. Or if you notice a sudden change in your hearing, you should have your hearing tested. If you have pain, itchiness, swelling, or a fullness in your ear that comes on relatively quickly, those are issues that you definitely want to go see your physician about. And the physician, in most cases, will recommend a video or an otoscopy exam, which what we do here at the facility here, we do video otoscopy, where we look in your ear and you can see right in your ear on a big screen. You get to see what we look at. But they'll order that to make sure there's nothing in the outer portion. Remember our auditory system, the outer, the middle, and the inner ear? So they're going to go through a battery of tests to find out where the problem would be. And they would order that. So just be sure. Now, a couple of things I wanted to touch on about treating hearing loss. Treating hearing loss is very important, especially treating it early. Unfortunately, the way it seems with hearing loss is that the longer we put it off, the harder it is later to try to recover. You know, Walter Reed Army Hospital years ago did a study. They took 500 men and women, and all of that group had hearing loss in both ears. Well, they fit that group. Half of the group they fit with 2 hearing aids, and the other half of the group they fit with 1. And they monitored their progress for 5 years. They wanted to see what were the results. And they went into this with a little bit of question in the beginning. 1, if I wear a hearing instrument, does that stop hearing loss? Number 2, the second question they asked was, well, what's the difference between a person that wears 2 hearing aids and the person that wears 1 hearing instrument? The other question they asked was about understanding, which was different than hearing. They wanted to know, was there a lack of understanding or a decrease in understanding by not wearing a hearing instrument as well? Well, after the 5 years, they basically came up with the results, and they proved that wearing a hearing instrument doesn't stop a hearing loss. It's with you forever, like luggage, okay? Once you get it, it's with you forever. Unfortunately, it just continues to decline. The other question that they had was about what was the difference between the one group that had 2 hearing aids and the group that had 1 hearing instrument. Interesting point that was made was that the folks that had the 1 hearing instrument remarked many times that it was much more difficult for them to hear and localize where sounds were coming from. Imagine if you have one ear that's better and the other ear is poorer, but you call to me on this side, yet this is my better ear. Instead of looking this way, I'm going to look in the direction where the sound is coming from. And these are the kind of problems that they experienced. They learned also that it was just a little more stressful for people that had 1 hearing instrument. It was hard for them to sit together at family get-togethers or at the luncheon. Bob, come sit on this side. This is my good ear. Things like that. They had trouble where they would not be able to localize. They had a little more stress with it. It was much more difficult. Now, the folks that did have the hearing instruments in both ears were able to understand better, to localize where sounds were coming from as well. And there was an improvement in their understanding. Speaking of which, what happened to the ear that they didn't fit? Well, that ear, they found, decreased in understanding about 26%. I'll say that again, 26%. That's pretty significant. So they went back. The next study was, because the first question is asking here, well, if they put the hearing aids on, will that come back? The downside for this was the understanding portion did not come back. When the hair cells lose their ability to send sensation, they become atrophied or weakened. They have to be stimulated. Too much noise is a problem, and too little noise is also a problem. You need to have some noise and you need to have some sound to keep everything working. So the point of all of this means that if you're suffering from these symptoms that we've talked about, you don't want to put it off. The sooner that you can get there to the dispenser or the audiologist or the doctor to look at this, the sooner that they will be able to help you if they find that they can help you with amplification, for example. With that being said, the road to recovery and hearing better with hearing instruments will be much better than it would be if you waited. A couple of things that we learn about the importance of having hearing instruments and amplification is that relationships are better. Obviously, you can communicate with other people. If you can communicate, you have less stress, you're not worried so much about that. Misinterpreting words, so it's just a helpful scenario, and relationships rely on good communication. So hearing loss can hinder that. Okay, earnings. This is an interesting thing I learned about, was that people that are earning their income, if they have hearing loss, they can suffer the effects of that hearing loss and maybe be passed over for a job. That is a subtle discrimination, but it happens. People find that they're not necessarily the candidate that the employer may want. The Better Hearing Institute did a study on this back in 2015, and they found out basically that by wearing hearing instruments, that it improved the person's income level in that area, that they didn't suffer the risks of the loss of income. I thought that was very good. Also, cognitive skills. We're learning that cognitive skills by wearing hearing instruments helps to reduce the effects or the onset, if you will, of dementia and Alzheimer's. So it's very important that using hearing instruments can help stimulate. Now, it's very interesting when we talk about dementia and we talk about hearing loss, many of the symptoms that a person with dementia and a person with hearing loss suffer are very similar. Withdrawal, anger, confusion, isolation, not understanding, cognitive recognition, things like this. All of those symptoms are very similar to someone that is having dementia. So a lot of times we have to be careful that we don't have our physicians, for example, we've seen some cases where physicians have misdiagnosed patients that have hearing loss rather than dementia. That's why it's so important to have hearing tests. And even if there was something leading to that, we're finding that using hearing instruments is a way to help people to stimulate that neural response to the brain. We realize that we hear in the brain. We don't hear in the mechanism, although that is a way to transfer sound. Where we really hear and understand is up here in our brain. Another thing, I think that it just makes people happy. Happiness. Hearing loss can make people frustrated. And, restoring the ability to engage in social life and live confidently helps to bring about a quality of life. And that's what we're after. Self-confidence. It brings back that gift of self-reliance, giving you the opportunity to be able to be maybe a little more independent. The best thing to do if you're suffering from these symptoms is to go and seek out a professional so that you can see if there's help for you. And they'll classify that hearing loss. They'll try to find out if it's something that can be helped medically or something that can be helped through amplification, through the use of hearing instruments. So I would urge you to go as soon as you can, if you're having symptoms like this, to go see a hearing professional. There's a couple of steps I wanted to let you know, and I want to talk about it. There are different groups of people, and we didn't talk about this as much as I'd like to, and so I want to bring it up now. Let's talk about the definitions of what's out there for professionals. The first one is an audiologist that I want to talk about. When I started in the industry 25 years ago, an audiologist only needed to have a master's degree. That's changed. The reason why I think it's changed in some reason is for reasons of notoriety and understanding. You have to understand the workforce with some of the things where the ear, nose, and throats and the audiologists working together. But I think it was more along the lines to help increase the education level for the audiologists to gain some respect in that medical community. That's a personal my personal idea. However, audiologists today are doctors most of the time if they have an AUD. Now, they don't do surgeries. That's what the ear, nose, and throats do. An ear, nose, and throat is also referred to as an otorhinolaryngologist, or another word you can use instead of the rhino, they'll just basically use them as otolaryngologist is what they'll call them. But that's a doctor that specializes in diseases of the ear, and they're the ones that can also do surgeries for you. Now, if there is no help for you through surgery, let's say, for example, you have a sensory neural loss, and this is a point that needs to be explained. Physicians, if they do not have any medical surgery to perform to make your hearing level or loss better, then they, by most circumstances, should refer you back to an audiologist or a hearing instrument specialist, a dispenser, because you could be helped through the use of amplification. Let's get back to the audiologists. They're licensed hearing healthcare professionals. They are clinically trained to evaluate hearing loss and related problems. This may include balance as well, balance disorders, and tinnitus. So audiologists typically are doctors of audiology. Now, in the state of Texas, the way we work in Texas, audiologists can do hearing tests and dispensers can do hearing tests. Now, that's a fitter and dispenser of hearing instruments. That's the second category I really want to talk about. And that's a hearing instrument specialist, or they may call them a fitter and dispenser of hearing instruments. Certain states require different candidacy, I guess you want to say, education requirements. Some require a 2-year degree, some require high school education, and other states require much more than that. Some states are asking for 4 years. In any event, the hearing instrument specialist is someone that's usually trained on the job. They are actually trained and they come under the wing, if you will, of a sponsor that teaches them from a practical application, interacting with patients on a daily basis. So that education is very good, I think. That's the way I started. Not to take anything away from audiology, that's a great, and I love that, and I even have a bend towards learning more. But to understand, they are licensed by the state, in this case in the state of Texas, to perform hearing evaluations. I am also board certified. It's a national board for certification. That's another level that you can take. It requires you to have a license in the state for 2 years, and then you can sit for an examination that has about 6 or 7 different categories that you must pass successfully. And then you can become known as board certified in hearing instrument sciences. The last category, of course, we talk about is ear, nose, and throats. These are doctors. When we find something is wrong through our evaluations and we have guidelines, if we find that there's something that's out of the ordinary, by all means, we always refer our patients to an ear, nose, and throat to rule out any kind of problem that would be hindering them, for example, to wear a hearing instrument. We want to make sure that they get help first. If it's very possible to have help through the medical intervention, we are definitely for that. And we always encourage our folks to go that way. There are several rules that dispensers have to follow. And in those rules, some of them are like what we talked about. Rapid hearing loss. If you've had a rapid hearing loss in the past 3 months, you should go see an ear, nose, and throat. If you've had a unilateral loss, all of a sudden one ear drops really quickly, and then that's another one that you definitely need to go see an ear, nose, and throat. If you have dizziness, and what I mean by dizziness, vertigo, that's something that if you feel that the room is spinning around or you're standing still and the room still looks like it's spinning, then definitely need to go see an ear, nose, and throat for that. Also, if you have pain in your ears, if you have pain, these are some things. These are kind of like key signals that we have to refer patients to an ear, nose, and throat. And of course we would. Some of the tests that we do, and this is important for dispensers and for patients that are out there getting hearing tests, is to make sure that they're getting tests where they're doing air conduction, like you saw the young lady getting the test with the air conduction, and then you saw me put that little bone oscillator behind her ear. Well, that is a bone conduction test, and those tests need to be done to find out whether or not there is any problem in the middle ear. Remember, we talked about outer ear, middle ear, and inner ear. So with that being said, if we find some of that, then we also refer you. That's known as an air bone gap. And if that is present at 500, 1,000, and 2,000 hertz, then we refer you to an ear, nose, and throat. These are some of the rules that we have to follow. I want to encourage you to come to have your hearing tested. If you find that you're having difficulty in understanding a noise, just in general conversation, you're missing out, not hearing the grandchildren like you used to, it's probably time that you get your hearing tested. So I would call you to go do that. Don't put it off. Make the call right away and get your hearing tested. Another thing, by the way, on top of all of this that we talked about, that's one of the rules, is if there's something or a foreign object in the ear. That's why we love to do video otoscopy here. And we want to see what's inside your ear. If we find a foreign object that's in there, could be anything. Over the past 25 years, we've seen quite a few things. Most of the time, we're going to see earwax removal. And now that's something I need to touch on. Earwax removal is something that is not necessarily that you need to be a licensed, qualified, credentialed physician to remove wax. There is no licensure law for that. Dispensers like myself, audiologists, can also do removal from wax. We can do that in our office, and we talked about that. That's a great machine that we talked about, the Irrigator. I love that machine. It's actually making it very easy for folks. If you're nervous about having someone look in your ear, or if you've had an experience in the past, we know some folks that have come in, had trouble in the past where their ear has bled, or they had issues because someone was not necessarily skilled as well. What we suggested is that they would come in to our office and come utilize the Irrigator. It's pain-free, it's quick and effective, it's very gentle. It's a reliable way to have your earwax removed from your ear. So I would encourage you. Hearing aids today, by the way, are smart. When I first started 25 years ago, we had one method, and it was tweaking the hearing instrument with a little micro screwdriver saying, "How's that sound?" Well, these ain't grandma's hearing aids no more. We have modern, sophisticated hearing instruments that are able to work, not only communicate back and forth with each other, but connect to smartphones and Bluetooth and able to be controlled by applications on your phone. Amazing technology. And that's just the beginning. We're now starting to touch on areas where we'll be able to take temperatures of your body, regulate if you've fallen, see if you've fallen down, be able to put an application on a phone to use so that you can translate from one language to another. It's all coming. So these aren't grandma's hearing aids anymore. So I want to encourage you to get your hearing test. There's no stigma involved with this. It's a beautiful addendum to our hearing. It allows us to be able to listen. And I am, of course, a user myself because I do wear hearing instruments. And that's because I received my hearing loss. I had a noise-induced hearing loss that was in the military when I was serving overseas in Germany. So I would encourage you folks to come in, have your hearing tested, and talk to the specialist. See if there's some applications or if there's an opportunity to help you to hear and engage in life again. Thanks for listening.